Okay, good evening, guys. I'm going to talk a little bit about universal healthcare and how the U.S. should implement it. I'm totally for universal healthcare. Um, and just to name the reasons why I'm for universal healthcare, I'm for universal healthcare. Um, Outside of being a taxpayer, just working in the medical field, I feel a lot of people avoid going to the doctor on cost, on co-pays. And outside of them wanting to know their results, whether good or bad, I do feel that a lot of patients avoid healthcare because of the cost. They avoid going to the doctor because of the cost. I feel it would lessen stress on families as far as people who are terminally ill and really need the care. Instead of just piling and piling up the bill, there should be some type of not necessarily leverage, but okay, we know this is $1 million. Not everybody has $1 million. We got you. You know what I'm saying? Type of mindset when it comes to healthcare, instead of having a patient sitting in the office or the hospital receiving this treatment and then boom, put this big old bill on their credit, and now they're not able to obtain a normal life because they're just paying this bill, this bill, this bill. So they're just living paycheck to paycheck. And then it leads to possible crime, possible, suicidal thoughts, depression, just nothing really positive, just totally a decline. So I'm totally for it. I totally feel that the government should be for their people and that they should want their people to be well and healthy, because I feel someone is more beneficial alive than they are deceased. It could cut down, on crime levels, on stress, on mental disabilities, of habits as far as, dependency on, medication, on recreational use, on alcohol, looking for negative outlets to relieve certain things. And if the taxpayer dollar is important, let's make the taxpayer dollar important. Let's not let it go to where they want it to go. Go where it's beneficial for your people and not for what you think it's for your people. And then you're really not even listening to your people to know what's beneficial for them. But, I don't know. It's just my opinion. I don't want to offend anyone. So a pro for universal healthcare, since I'm totally for it. Universal healthcare will guarantee basic care. No one would have to go without care because they don't have a job or can't currently work. Businesses would not have to fold due to the exacerbated, as I said, and rising costs of providing health insurance to the staff employees because there would not be a greater control of costs. Everyone would be able to obtain the same level of care and lead to healthier workforces and possibly longer life expectancy. If it starts from birth, where someone can have, a balance of healthcare insurance and not something that's fluctuating, or that they have to pay for, or that goes up this year and doesn't go up that year. The patients wouldn't hold back from going to the doctor or be afraid to go or put things off. It can lead to things being less segregated as far as your PPO, you're better, or your HMO, you gotta wait 3 months to see a doctor. If that makes any sense. I'm sure it may be familiar to some who have certain insurances or are treated a certain way based on their insurance. That has happened to me. And also, no one will go bankrupt over all these crazy medical bills. Recently, I had surgery, right? And I have PPO insurance. And, me not doing, my research when it comes to insurance, I'm like, okay, I got PPO, I'm good. I pay my bi-weekly, I pay my copay, so I have insurance. I have a $3,000 bill for my insurance for when my insurance didn't pay. So it's like, okay, PPO did not really do the best thing for me. I was better off having a state-funded insurance that would have covered my emergency expense. And you would think an emergency expense would be covered, but I had to pay 20% of my emergency situations or my hospital stays. So go me with PPO, right? I don't know why, but I was really under the assumption that PPO was like the best insurance. And it's really not, in my opinion. It's good as far as like if you want to go somewhere without a referral, but it's not the best as far as coverage. You're really more out of pocket for a PPO than you are cost friendly or like coupon type of thing. There's no deal in PPO. So the United States is the only state or the only country that is industrialized nation that does not have universal health care. I feel like with being able to pay for medication and treatment, it will be beneficial to have your people alive than, dead, of course. So if you can make things more effective as far as setting up a plan for our people, listening to our people, because we the people supposed to make our little nation, our world, that things would maybe come to some type of clarity, not so much a demise all the time. But everybody has an opinion, and I don't know why politics are with healthcare, but healthcare is really like a booming business, so it makes sense, right? Politics and money is always going to go hand in hand, right? It's always about what they're getting, in my opinion. So, just some universal systems that are already implemented are socialized medicine, single payer system, and private insurance. So I'm sure some of us are already familiar with private insurance. In private insurance, you're mandated to pay a cost to obtain whichever plan you choose, whichever insurance company you want to roll with, right? And it, of course, is more costly for the consumer and nobody else. Everybody else is winning, right? So for socialized medicine, the government owns the hospital, and then the doctors and all the other staff are considered government employees, and this is a system that is implemented by Canada. Now, the single payer system is where the government funds businesses, but those businesses are still private. So it's really up to them if they want you to go there or not. But they're funded by the government, and that's something that certain countries in Africa are using. Single payer system is more costly than socialized medicine, but both of those two are governed by the government. They're funded by the government. So single payer system is I'm paying for insurance. So I personally feel that I pay bi-weekly for insurance, and I don't really use it. I would go for a physical and my annual wellness exam for female, and that was about it. Recently, I had my surgery and I needed it, and I haven't been used to a PPO. I have a PPO insurance, and when I had HMO covered everything. I didn't see a bill. I didn't know about a bill. Everything was just with the company that I went to or doctor's office and the codes or whatever needed to be done there. But with PPO, I have a huge bill for my surgery. I have bills from the lab that I went to all the time. I have bills even from paying deductibles when I go to my doctor's office. And it's a little like, wow, this is a lot of money. Like, oh my goodness, this really isn't beneficial for me. And I should have done a little bit more research on what I was obtaining because, oh my goodness, I went to the lab and I'm paying $50 and then I'm getting a bill in the mail that I need to pay $108. Like, wow, oh my goodness. And they told me I was just paying $50 because that's all I would have to pay. And then I'm getting a bill like, you got to pay more. Or I go to my doctor's office and I'm paying $60 deductible. And then boom, I'm getting a bill in the mail. Like, oh my goodness, I've never had so many bills in my life outside of, my household living costs. Oh my goodness. So I'm totally for Universal health care. I would love to have health care that didn't drive me crazy and maybe give me gray hairs now, because I've never had so many healthcare bills in my life. Oh my goodness. But I'm totally for it. I think it will be beneficial for the people, whether young or older, anyone with terminal illnesses, anyone who was brought into this world and, nothing happened to them for that to happen. It's just genetic. It just happened. It was just, a rare disease. They were born this way. Whatever the case is, I feel everyone deserves a fair shot, and even a fair shot with healthcare.